Good afternoon and welcome to our November Dementia Dialogue. My name is Heather Mulder and I will be your moderator today. A bit of housekeeping before we get started. You will have the opportunity to submit text questions today to today's presenter by typing your question into the question pane of the control panel. You can send in these questions at any time during the presentation. I will collect them and then we will address them at the end of the session today. As a note, today's session is being recorded, and within 48 hours it will be posted on our website for future reference. You will also notice in your control panel there is a handouts pane as well. You can download today's presentation. It is my pleasure to introduce our presenter today, Mary Lou Hernandez. Mary Lou is a licensed clinical social worker in the Stead Family Memory Center at Banner Alzheimer's Institute, where she's been employed for the past 10 years. She works with patients and families to address a variety of non-medical needs, ranging from strategies for successful daily living to planning for the future. Her emphasis is to assist families with transitions of care, focusing on proactive planning. She also teaches various community education classes and facilitates support groups. Prior to working at Banner Alzheimer's Institute, Mary Lou worked at the Banner Hospital System as a medical social worker. Her focus was primarily with orthopedic and neurology patients. She also has experience working with the Social Security system. Mary Lou received her bachelor's degree in social work from Syracuse University and her master's in social work from Arizona State University. She also has a certificate in gerontology studies from ASU. Please welcome Mary Lou Hernandez.
Welcome everybody to the webinar on facing financial issues. During this session, we're going to talk about the cost of dementia care, the importance of having a financial plan, and options that help pay for long-term care needs. So why is the cost of care a concern? We all know that Alzheimer's disease and other dementias are progressive conditions that require more care as a person's independence declines. The average life expectancy from the diagnosis is about 8 to 10 years, but clearly this varies for each individual, and other chronic conditions can affect this. But very early in the diagnosis, people begin to need assistance with various tasks as their ability to plan and organize become more impaired. So they may need help with finances, household chores, managing medication, personal care. And as the illness progresses, they eventually will need 24-hour assistance and supervision. I think it's helpful to review some of the statistics about the cost of care, and these are from the Alzheimer's Association, their 2017 facts and figures. So most significantly is that dementia is one of the costliest illnesses for our society. They have noted that more than 15 million unpaid Americans are providing care. And this would include family members, significant others, friends, and a combination of all those people, because sometimes it takes a village to care for somebody with memory loss. So the total cost of care in 2017 is expected to be $259 billion. And $56 billion, or 22% of this, represents out-of-pocket costs, where that would come from savings and resources and income that's coming in. The average out-of-pocket cost was $10,315 annually, compared to a little over $2,000 for a person without dementia. That's an $8,000 difference, which is quite significant. And they've also noted that people with dementia receive more care from family and unpaid caregivers, from paid care at home using agencies, from attendance at adult day health centers, and when people have to be moved to a residential care facility. They've also noted that there's more transitions between care options, meaning that the services above are used more frequently and between different levels of care. So a person that's living at home may have family coming in and helping, and additionally they may have an in-home companion, and they also may be attending an adult day health center. So there's a lot more transitions between care. And aside from that, they may have some home health under Medicare. They may have a skilled nursing facility stay under Medicare if they've had a hospitalization and need a short rehab stay. So they've noted that there's more transitions between care. So clearly the cost of care is expensive. So with that, as a social worker, I've seen throughout the years that options to pay for care can be very complicated, very confusing, and people don't always know what to do and what kind of planning they need to make. And a lot of times there's misunderstandings and misinformation. You know, insurances are very complicated, so all the things that are covered aren't very clear, and many people think that the insurance will cover a lot of services that it will not cover. And a lot of people also think that if they apply for benefit programs, I have to give them all of our savings, or that I have to give them my house, and that's not necessarily the case. We see that spouses worry that everything that they've worked hard for and saved will be lost. We have adult children worrying that they're going to have to stop working because mom or dad need care and they don't have the resources, or that they may have to start paying for care. I have a lot of adult children that worry when mom and dad's money runs out, then they have to step up and pay for the care. And the goal is that we don't want this to happen because adult children have to save for their own retirement. So I'm a big advocate for planning for the rainy day, thinking ahead of time what might be needed before a crisis occurs. It's good to have a backup plan rather than reacting. So we have some risk factors here that talk about when a rainy day may come, and it is a little bit different for everybody because everybody's situation is different. But for the person with dementia, eventually, if they're living alone, they're not going to be able to live alone because they're not going to be able to manage all the activities that they need to do. So again, thinking ahead, what would the backup plan be? Or they're not safe to be left alone because, again, if they're with a spouse or an adult child that's working all day, they may not be able to manage the day by themselves, cooking their meals, being safe, knowing what to do to keep themselves occupied. When the person with dementia needs physical assistance with bathing, dressing, and grooming, that may become difficult for the primary caregiver. If it's an adult child caring for a parent of the opposite sex, it may be hard for them to help them in the shower or to help them with toileting. The person with dementia may become resistant to care assistance, and it may be a struggle for the primary caregiver to be doing that. Maybe that's when outside help is needed because they may be more cooperative. And if there's safety concerns, such as wandering, putting pan on the stove and forgetting about it, those things are all very concerning. And then for the caregiver, for the primary caregiver, the rainy day may come when they're overwhelmed with all the added responsibilities because clearly the caregiver is now doing their tasks and the tasks that the person with dementia was responsible for. They may have a hard time keeping the person with dementia occupied. You know, spouses aren't always the recreation directors and the activity planner, and when they're doing everything else, it may be hard for them to know what to do to keep the person occupied. So having a companion or adult day health may help them with that task. The caregiver may have increased stress, anxiety, and depression because, again, roles are changing, responsibilities are increasing, and this can be very overwhelming. We also have a lot of caregivers, spouses especially, that may have medical conditions that make it difficult for them to be a caregiver. We have spouses with dementia that have the physical brawn and spouses that have physical limitations that are cognitively intact, but it may make caregiving difficult for them. And there's times when managing behavioral changes can be very difficult and stressful for the primary caregiver. So those are some of the things to think about. And again, thinking ahead and having a plan if some of these situations occur makes it a little bit less stressful, a little bit less of a crisis. So once a diagnosis of a dementia has been made, it's helpful to create a financial plan, to have the primary caregiver and perhaps other family members that are going to be involved in care being aware of what's available. So when more care is needed and when you have to look at options, people know what is in place and what's available and what can be used or what you may have to move towards. So you want to inventory income and resources. What is the monthly income or pension that a person's receiving or a couple are receiving? Are there savings? Are there investments such as 401ks or IRAs, stocks and bonds? Is there property that is in place as a resource that couples may not be living in or a person may have as an investment? So just being aware of that's helpful because then you know what's available for future use. I see a lot of families, the adult children, maybe have to start getting involved in helping plan for parents' care, and they have no idea what's in place or what's available or where to go next. It's important to have a durable financial power of attorney established so that a trusted person can step in and manage finances when the person with dementia is no longer able to do that. It's helpful to be aware of what insurances are in place. Is there long-term care insurance? What is the medical insurance? Is there a supplement? Is there VA benefits that help with medical care? And be aware that many services begin as private pay. There are programs that we'll go over through the course of this, but a lot of times private pay is initially what begins various services. So long-term care insurance, if it's in place, can be a great asset, but be aware that this is not something that typically can be established once a diagnosis of dementia is made. So people usually have this in place. They've gotten it when they were a bit younger and in fairly good health. But if it is in place, it's important to be aware of it. So know that policies are varied. A lot of people sign up for individual policies, so it's good to pull the policy out, review it, see what's covered. Look at what the coverage is as far as daily amounts, and that can vary. I see coverage between $100, $150, $200, but sometimes even lower than $100 depending on how old the plan is. And what are the coverage limitations? Is there a maximum? Again, some policies cover up to $200,000, $300,000. There are some older policies that once it's started, they're unlimited, but I don't think they're writing those anymore. You want to look at, is there a waiting period before the policy begins? So many times there's a 30-day waiting period or a 90-day waiting period to where services would have to be paid for privately before that. And how is the policy activated? So many of my patients have the policy activated by having a cognitive impairment rather than the inability to do certain activities of daily living. Because with a cognitive impairment, people may be able to dress themselves and feed themselves, but they may not be safe to be at home alone. So looking at the criteria for that is helpful. And what is covered. So again, policies are written and they're very varied. So some policies only cover care in a skilled nursing facilities. Some cover assisted living or other types of residential care. Some, in addition to that, will cover in-home care or adult day health care. So it's good to look through the policy and see what is actually covered. The good thing about a long-term care insurance policy is that it can preserve savings. So we always want families to use this before they use all their savings, because you want to use it in a timely manner so that you get the most benefit from the long-term care insurance. If you can use the long-term care insurance, your money stays in the bank a little bit longer, and that's your money. If you don't use a long-term care insurance policy, that you're not going to get the money that you paid into it back. And the other thing that's helpful to know is many times once the policy is activated, the premiums stop. And that can be a nice addition to the monthly income once the premiums end. I always like to mention that Medicare is not a long-term care insurance plan. Some people think that some of the services needed for dementia care will be covered by Medicare, but it's really pretty limited. Medicare really covers acute care needs. They cover a stay in a hospital, a very short stay in a skilled nursing facility, or very limited in-home care, but they're all based on needing a skilled need. And in-home care is for a service, they're in, they're out. Most of the care that a person with dementia needs is assistance or supervision for safety, help with personal care, help with household chores, cooking a meal, giving medication. And Medicare considers those custodial needs, not skilled needs, and so most of those things are not covered on an ongoing basis. And if you have a Medicare supplement or a Medicare Advantage plan, they're really also based on Medicare criteria. So again, they would not cover that. The one exception that I always like to mention is when a person does qualify for hospice, because that is covered under the Medicare Part A benefit. But again, that's more end of life when a person is in the very advanced stages and they meet the criteria for hospice. Another benefit that can be helpful in helping pay for care is the VA Aid in Attendance program. So this is a program for veterans who had 1 day of active duty during a period of war. And they had to have had 90 days of active duty with 1 day during the period of war. And the war times that most of my patients are involved in were World War II, the Korean conflict, or Vietnam. And it's important to note that they didn't have to be at the war site. They only had to have been in during the period of war. So actually, the veteran, if they're applying for this and they qualify, this can be for a veteran or a surviving spouse. And they have to require care on a daily basis. So there's quite a lengthy application that needs to be completed showing what the care needs for the veteran or surviving spouse are. But the single veteran can actually receive up to $17.94 per month. A couple can receive up to $21.26 a month, and a surviving spouse up to $11.52 per month. And the way that they receive the benefit is based on what they call unreimbursed medical expenses compared to monthly income. So what does that mean? It means that, for example, if a veteran is living in an assisted living center and the cost is $4,000 a month, but that veteran only receives $2,000 in income, then that veteran is paying more out for care than he has coming in, so he would get the full benefit of $17.94. Or if he's there with his wife, he would get the $21.26. So the unreimbursed medical expenses are really the key for knowing how much they can actually receive, or the veteran can actually receive. They do look at financial eligibility. So my understanding is that if you have only enough money in the bank to last for a year, you can be eligible financially, and they do not count the house or a car. So for more information on the program and where to apply, we have the website online and an 800 number that you can get more information on this program. The other program that a lot of my families may need to apply for sooner or later is the Medicaid program in Arizona, which is called Arizona Long-Term Care. It is the long-term care part of our Medicaid program, which is actually ALTCS, the Arizona Healthcare Cost Containment System. So Arizona uses different terminology, but they are the Medicaid program in Arizona. So ALTCS is a federal program, or Medicaid is a federal program run by the state. So in every state, the eligibility criteria varies a bit, and I'll end up reviewing what the criteria in Arizona is. But ALTCS covers care in residential facilities and also home and community-based services, such as in-home care. It can cover up to 40 hours of care in the home, or cover attendance at an adult day health center. So I have many families that worry about applying that, oh, my person's not in a residential setting yet, so I can't apply, and that's not necessarily the case. They do support people with dementia who need care at home. And be aware that ALTCS, or Medicaid long-term care, is the payer of last resort, so they want all other benefits to be applied for first and used. So for example, if I have a family going to apply for ALTCS, and the person may be a veteran, and they haven't applied for VA aid and attendance, ALTCS will ask them to apply for aid and attendance and show proof that they did that. So in order to qualify for ALTCS, applicants must qualify financially, but also medically, which is different from the regular ALTCS program where you only qualify financially. And I will review that criteria in the next few slides. So this is a financial eligibility for 2017 that I will be reviewing. The income and resource amounts typically go up a little bit every year. So in 2018, I will expect that some of these amounts will be a bit higher. So for financial eligibility, ALTCS looks at income, and they look at resources or assets. So first we'll look at income. So for a single person, the monthly income must be below $2,205, $2,205. For a couple, they would double the $2,205. So if the couple's monthly income is below $4,410, then the person that they're applying for would be eligible. But they would also just look at the individual's monthly income for a couple, and if it's below $2,205, they would be eligible. So in other words, you may have a couple that you're applying for the spouse who gets $2,000, and then the other spouse may get more than that, but all they'll look at is the $2,000 from the spouse. We have couples where one spouse may be working and the person with dementia isn't, and so that spouse's income may bring them over the $4,410. But if the spouse that they're applying for is under $2,205, they'll just look at that. But what happens if the monthly income is over the limit? You may have a single person and all they're receiving is $2,205, and they may have needs. And when we look at the assets have to be spent down. So if it's spent down and they're needing care that costs $5,000 a month, what happens? So if the monthly income is over the limit, then there is a thing called an income-only trust or a Miller's trust that can be established to compensate for this. This is typically done with an elder law attorney that understands what a Miller's trust is, and then the person is able to be eligible. So it's just a bureaucratic way to get around that. And then, in addition to income, in determining financial eligibility, resources are looked at. So what resources are looked at? They're gonna want proof of checking, savings accounts, their credit union accounts, cash, stocks, bonds, IRAs, certificates of deposits, 401ks, the cash value of life insurance policies, and property that people aren't living in. So if somebody has a vacation home up north or property in another state, they would count that as a resource. They do not count a couple or a person's primary residence, but that needs to be taken out of a trust, because if it's in a trust, it's counted as a resource. They do not count one vehicle. You can have a burial plot or an irrevocable or prepaid burial plan, and they don't count personal belongings. So if somebody has a valuable painting in the house, they're not going to ask you to take it down and sell it. So again, for a single person, resources have to be spent down to $2,000. So when resources are spent down to $2,000, then the person could be financially eligible for ALTCS. But for a couple, it's a little more complicated, or a little more advantageous, maybe I should say. A number of years ago, the federal government realized that it wasn't right for all of a couple's shared assets to be spent on a spouse who needs care. So they established the community spouse resource deduction as a means for the well spouse not to be placed in poverty and not have anything to fall back on for their own care needs. And I always feel it's very important to review this with couples, because it's not something that's always very well known or that people are aware of. So the community spouse resource deduction is determined by the ALTCS office. So this can be applied for when the person with dementia meets the medical criteria, which I'll go over next, but basically when they need care on a daily basis, or as the ALTCS people would say, at risk for nursing home placement. So we wouldn't recommend this being done in the early stages, but usually in the moderate, when they're needing help with most daily activities. So the well spouse can keep half of the shared assets up to $120,900. And at the minimum, the well spouse can keep $24,180. So what does this mean? I know it can be a little confusing. So, for example, if a couple have $200,000 and one spouse has dementia and is progressing and needs a lot more assistance, then the couple could apply for the community spouse resource deduction. So the spouse that had dementia, ALTCS would say, you're not eligible, but you have $100,000 from the $200,000 from the couple. The well spouse is able to keep $100,000. When the spouse who has a dementia, when their $100,000 is spent down to $2,000, the well spouse would go back into the ALTCS office and say, I've spent down to $2,000, which has to happen within a year, and then that person would be made eligible. So it's very important to keep in mind, because it's definitely a way that the well spouse can preserve some of their shared resources. The only person that can spend down the spouse's share that has dementia is the well spouse, and so they could spend it on things for them as a couple. If they wanted to take a trip, if they need a new car, if they need something repaired in the house, if they need new appliances. But what they can't do is they can't give it away to other family members, or give it to the grandchildren's college fund, or help a child with the down payment of a house, or make a large donation, that would be considered a transfer of funds and a penalty. So it has to be spent for the couple. But very important to keep in mind, because again, I've seen couples that have spent their funds, and ALTCS isn't going to go backwards and say, oh, you should have had this preserved, so we're going to give you the money back, because they don't do that. And then the other part of eligibility to get on ALTCS is medical eligibility. And when an application is started and you're doing the financial end of it, there will also be a visit by a person that does a pre-admission screen or a PASS. And this is typically a nurse or a social worker that'll visit the applicant at their house, or if they're in assisted living, at the assisted living facility, because they need to evaluate the person that's being applied for. And so I always stress that when it's a person with dementia that you're applying for, it's very important to have a family member or caregiver present that knows the physical abilities of that person, because this is a point system that's made, so they have a series of questions that focus on behavioral, functional, cognitive abilities. So they're going to assess how much help does that person need with activities of daily living, with bathing, dressing, feeding. And again, I always stress to families, really think about how a person is managing those things, because I may ask, oh, is your person bathing independently? Oh, yes. And as I question a little more, but let's see, they're not bathing as frequently, and they're sometimes resistant, or I have to help turn the shower on, or I have to help with the toiletries, or it looks like they're using shampoo to wash their body. So that's not being independent with bathing. Maybe they can scrub themselves, but they need a lot of prompting. Do they need help with medications? Are they forgetting to take their pills? Because that's significant. Are they walking independently? Do they have frequent falls? Are they incontinent? Do they wear adult briefs? Do they need help with toileting? Are there safety concerns? Are they wandering? Are they leaving items on the stove that are burning? Are they putting metal in the microwave and plastic in the oven? And are there behavioral issues? Are they aggressive? Are they physically, can they be physically combative? So all those things are very, very, very important. And I suggest that you begin to journal some of the assistance that's needed, so that you're remembering things, because as caregivers, many people are so used to the changes that it doesn't seem different. But I think if you begin to journal it, you're going to remember things. And I always suggest you present the person on their worst day. You talk about their worst day, not their best day. This isn't where we want them to look good and independent. This is where we want them to look dependent. And many times, caregivers are reluctant to share this information in front of the person. And many times adult children, they want to be respectful to mom, and I can't say that she doesn't do these things in front of her. So this is where you might step out with that pre-admission screener and say, can I talk to you alone, so that you're able to give them the full picture. And it's important to have medical records, because again, it's a point system. They get certain points for having a cognitive impairment diagnosis. So again, a few more tips about ALTCS. They do look at transfers of assets 5 years back, and that can result in a penalty at the time of eligibility. So it's very important, if there's a thought that this would be needed in the future, to really be cautious about giving money away, because that can result in a penalty. There may be an estate recovery on a single person's home. So that would, you know, that doesn't typically happen with a couple. People worry that they may take the home from the well spouse, but that does not happen. Nowadays, applications are started by actually calling the ALTCS office, and rather than having to go in. Years past, you used to have to go into the office and have an interview in person, but now they've gone green. So in Maricopa County, we have the number on the screen, the 602-417-6600 number. But there are offices throughout the state and in other counties, so those numbers can be found on the ALTCS website under locations. The other thing to keep in mind is that the handouts on ALTCS, the information that ALTCS does send out, is pretty reader-friendly. So there's publications on the website that explain some of these programs more in depth. They explain the estate recovery and the Miller's Trust. So those, you know, the website can be helpful in explaining the program a little more thoroughly if need be. I always like to mention Social Security disability because we are seeing more younger patients that are diagnosed with dementia, whether it's Alzheimer's disease, frontotemporal dementia, and many times those people are working, and working will eventually stop because with the dementia it becomes too difficult. So frequently we're recommending that people apply for Social Security disability. So one of the first things to be aware of is a person has to have worked 5 out of 10 years before the disability began. I think sometimes this is a disappointment for stay-at-home parents that may have contributed a number of quarters to Social Security, but they haven't worked 5 out of the last 10 years, so they're not able to get a disability benefit. Social Security has a whole list of diagnoses that are called compassionate allowances, and the goal of those is to expedite the application process for people that have these particular diagnoses, and people with young or early onset Alzheimer's disease, that's included in the list. Lewy body dementia is included in the list, as is frontotemporal dementia. I always like people to be aware that if they do qualify for Social Security disability, Medicare does not begin until 2 years after the entitlement date. So it's important to have another resource for insurance in place because, again, Medicare does not start right away, and with a dementia, having insurance coverage is so very important so that the proper medical care can be in place. The SSA.gov website is very good. It has a lot of information on Social Security disability. There's a disability planner, a lot of interactive information on the program to get to be more informed. And know that you can start applications actually online at that website, or you can start it by calling the 800 number for Social Security and getting an appointment to do the application over the phone, or even going into the local Social Security office. The Area Agency on Aging actually manages the National Family Caregiver Support Program, which is a federally funded program to give respite care for caregivers, because the federal government realizes that this is a very exhausting task for people that are caregivers. So there are federal funds to help with this. And what I usually see people getting is a few hours covered for adult day health care or some in-home care. So some of my families will get 2 half days of coverage at an adult day health center. There's frequently a waiting list because there's a limited amount of federal funds, but I always recommend that people get on the waiting list because It can be reduced as people go off the program because they're eligible for other benefits, or sometimes the federal government will have a fund of money that they're contributing, and the waiting list goes away. So it's always good to get on the waiting list. And in Maricopa County, a referral is made by calling the helpline through the Area Agency on Aging at 602-264-4357, or the 800 number, the toll-free number. Once a referral is made, a case manager visits the home within typically 5 working days and does an in-person assessment. When an intake is done, they do ask about income and resources, but this is not an income-based program. So they ask it for their statistics, but it's not going to prevent people from being eligible for this program. And for so there's area agencies in other counties in the state and in other states throughout the country. So one way of finding out where it is in your local area is to visit the website that's on the page, and you can find out what's closer to you if you're not in Maricopa County. I always like to give a shout out about the benefit of using elder law attorneys, because they can be very helpful in planning for long-term care needs, especially if there's more complicated finances or questions on, what are shared assets, or when there's a couple together and the best way to plan to protect for the couple. So they're very familiar about long-term Medicaid programs and the VA programs. Sometimes they can actually help with these applications for a fee. They're the ones that can establish an income only or a Miller's trust when the person is over income for the ALTCS program, and they really know how to preserve assets for the well spouse. So I frequently recommend that people have a consultation with an elder attorney, because again, sometimes spending a little bit of extra money can save money in the long run. So we have a list of elder attorneys on the Banner Alzheimer's website at banneralz.org, or for other areas, there is the website on the page, the naela.org can give you elder attorneys in your local area. And at Banner Alzheimer's Institute, we do a planning ahead class on a frequent basis. It talks about legal financial planning. It's a little more in depth, and certainly you have the ability to ask questions and interact. We have an abbreviated version of this class online at banneralz.org in the education section on our website. If you're a patient here and you see one of the social workers, this is where you can ask questions about your person's progression and plan for increased care needs, sort of do that proactive planning. And again, my focus is it's better to be proactive rather than reactive. And know that we have a lot of other classes at Banner Alzheimer's Institute to help people be more dementia aware and know what to expect and how to plan and how to prepare. So on our website, under education, you can certainly find a list of our upcoming classes. So questions?
Thank you so much, Mary Lou. I think you went over a lot of really valuable information that people tend to have a lot of confusion about. I'll remind our attendees you do have the opportunity to submit questions to Mary Lou in the questions pane of the control panel. Well, in the meantime, we have had a few questions come in already. way back at the beginning of the program, you were talking about reasons that we may be looking for additional care and looking for resources to pay for that care. And you mentioned for the person with dementia, often this comes when they're living alone. Do you have some kind of big red flag indicators of when it's not safe for that person to be at home by themselves anymore?
A number of red flags. So if they're not taking their medications regularly, if they're losing weight and not eating, if they appear fearful, if they're, if you go in the house and you look in the refrigerator and the food is spoiled, or maybe you go in the house and a meal is in the microwave that's cold, that's been there for a long time. I think we have a living alone checklist that is available. I'm not sure, Heather, if it's on our website or not.
It is on our website. If you go into the printed materials section, it's actually, we put together care tips that will help you kind of check off, like you said.
Right, and so that has a live alone checklist. It has a number of risk factors that show why, when those things occur, what makes living alone unsafe.
Okay, perfect. Thank you. I know often it's hard to tell, and sometimes, when we're not with the person, we don't have a clear picture of what's actually happening in the home. And we talk to them on the phone and they say, everything's fine. Of course I'm eating. Of course I'm taking my medications. So
that's when people have to be sort of detectives and really be observant and come over more frequently.
Right.
And see how safe that person really is.
Mm-hmm. So let's move on to a question about long-term care insurance. Now, I know when comparing Medicare plans, the government has a fantastic Medicare.gov website that will help you compare all of the different plans that are available. Is there something like that for long-term care insurance that's non-partial, or do you just have to reach out to all the individual plans?
I know that the Arizona Department of Insurance on their publication section does list all of the long-term care insurance plans for Arizona. I don't think they have a comparison. I would probably do a Google search and see if there's a tool that might give you some things to look at when you're comparing it. But, I think, you can probably think of some things just specifically, cost probably being one. Who's going to give you the most coverage for the least cost? But yeah, I don't have a particular website for long-term care insurance. The National Council on Aging may be a place to look because they have a lot of resources for consumers. So I would also think about getting on their website to see if they have something for long-term care insurance, because I know they have things on reverse mortgages and such.
Okay, perfect. All good suggestions. We did have a few questions come in about Medicaid or the ALTCS program. Just briefly, could you describe for us again, since there is such confusion about this, what is the difference between Medicaid and Medicare?
So Medicare is a benefit program that people receive through contributions from work or being a spouse. So a wife, if a husband worked and has Social Security, you get Medicare because you paid for it, and the wife would get it as a spouse. Medicaid is a financially based program. So it's based on financial need. So solely based on income and qualifying financially, but with ALTCS, in addition to qualifying financially, you're qualifying medically.
Okay, perfect. Thank you. We have a bit of a situation that came in, and this is again referencing Medicaid or the ALTCS program. Their person was denied Medicaid, but they definitely need that sort of support. Is there anything that this family can do to still try to get their person on the program?
Oh, I guess I need to know why they were denied. That's a very broad question. If they're denied financially, then it would be a matter of resolving why they were denied financially. Again, if they're over assets, then it's a matter of spending down, come into the, if it's one person, the $2,000. If they were denied medically, then it's, I think, important to be very specific about the medical needs of that person, because I frequently see people that qualify financially, but they're denied medically. So if they're denied medically, sometimes doing an appeal tends to be more lengthy. What we've heard typically recommended, and this is what more of my families have done, if they're denied medically, we suggest just going in and reapplying and then providing the updated information, the more thorough information as to why that person should qualify medically. An option is to consult with an elder attorney, especially if maybe it is financial, so that they can help give some guidance on how to meet the criteria. Sort of a broad question. I hope I answered that.
It is, and I'm surprised to learn that the appeal process tends to take longer than resubmitting a new application.
Well, one of the things that we've understood when families have tried to do the appeal is that they've been told that they will not use additional information. I've heard varied responses on this, but I did have a family particularly when they were trying to appeal and their parent was assessed here, so they had a better diagnosis and such. They were told that they couldn't use that for the appeal. That's why they recommended that they reapply, because then they could use the additional information. So
that's a great strategy to keep in mind. So moving on to the community spouse resource deduction, you had mentioned that there was about $120,000 maximum that the well spouse would get to keep, and if they were above that, then they would have to spend down to that amount. Does that include an IRA?
Yes.
In those resources, so they would have to dip into that to then make it to that $120,000.
Right. So for a couple, the key figure is like $240,000 because it's half the shared assets. So half the shared assets would be about $120,000. So if a couple has $240,000, the one person needs care on a daily basis and might meet the medical criteria, then they could consider applying for that. If they have more than that, they would need to then reduce their income to that before they apply. But 240 is the top figure.
Okay.
But yes, IRAs count, and it doesn't matter if the IRA is in the well spouse's name, it's community property.
Okay, that's a good clarification to have. Moving on to VA benefits, we had a question about that process. Are the benefits for the spouse who was in service only, or for the veteran only, or can the spouse also access VA benefits if the veteran has passed?
Yes, that's what the surviving spouse is. So if the veteran is passed and that spouse has not remarried, then they could access benefits, yes.
Okay. What about, it seems like these applications and the approval process takes quite some time. Do you know what are the average time frames to get onto Medicaid, VA, Social Security, disability?
Well, okay, so they're all very different. The ALTCS Medicaid application it takes about 3 months. Approximately. I mean, again, it depends how complicated the situation is. It could take more, but about 3 months for that. I've heard that the VA aid and attendance application can take up to 1 year. That's a lot more lengthy. They do pay back retroactive to when the application was started. Social Security disability, there's a 5-month waiting period after the start of the disability, and I think it can take about that amount of time to process the application. And those are all approximate. Depends how complicated a situation is, how quickly people get all the information in that they're requesting, but those are approximate times that I'm aware of.
Okay. And then one final question. Can these applications really be done by an individual or a family, or is it important that you involve an elder law attorney in these?
Yeah, a lot of my families do all these applications, but everybody's different. For some people, the ALTCS application is just so overwhelming that it's hard to do. I know I've had families where I'll explain maybe to the spouse who's trying to do everything else about the program, and it's just confusing. For some people, adult children, they may be busy with everything else. It's just easier to pay an elder attorney to do that. Mm-hmm. So I think it depends. But Social Security disability, most people do those on their own because the Social Security office is going to walk you through the application. Aid and attendance, again, it's just a matter of filling out the form, sending it in. Many of my families do them on their own. But again, there's times when people prefer to have help with it. Or if it's more complicated, an elder attorney knows how to help them with some of those more complicated situations.
Great. Thank you so much, Mary Lou, for sharing your expertise on these topics that so many people have so much confusion over. I do want to remind our attendees today that we have recorded this session. It will be placed on our website within 48 hours of the end of today's recording. As soon as we end the recording as well, we will have an evaluation that will be emailed to you. Please do take a few moments to fill that out for us. Let us know what you thought of today's presentation and also what else you would like to learn about, because we craft these dialogues with you in mind. I do want to invite you to join our December Dementia Dialogue, which will be on Wednesday, December 20th, entitled Visiting Notes for Families. And this is really going to discuss how can caregivers and the person with dementia deal with social isolation, the issue that of family members and friends kind of falling away and losing contact with them. How can you keep them connected and involved with you and your person? Thank you, everyone, for attending today's dialogue, where we bring the dementia education to you.